Brussels is the health cluster of the Brussels region. We have a specific focus on medical technologies and digital health solutions because of the critical mass. So it means that we work also with biopharma companies, but the idea is more to provide them with new and innovative digital health solutions. This is the way we work with them. Just to explain a little bit the context, so we are part of Hub Brussels. This is the economic development agency of the Brussels region, and we are funded by the Brussels government in order to provide information and coaching to entrepreneurs in the Brussels region. So all the clusters are incubated in the same agency. So it means that we work also with ecosystem in digital health, in digital solutions, on multimedias, on different topics that could be useful for the region. So we are an ecosystem of about 180 members, of course, many companies, but also lots of intermediaries and other actors. Like, the health ecosystem is quite broad. So we work with hospitals, with academic labs, with universities, higher education schools, etc., etc. And we work also with the different government that we have in Belgium and in Brussels. So this is why we have so many intermediaries and partners inside the ecosystem. So we are a small team, about 6 person, providing different kind of support to the entrepreneurs and to the ecosystem. I will come into details just after. Yep. So one of the main action that we have as a cluster is also to provide coaching and support to the entrepreneurs, to help them to find the right subsidies, the right funding, to find the right business model, to help also on the regulation aspects in Belgium and in Europe. So, and therefore that's quite useful to be part of the economic development agency of the region, because we have many expertise inside the company to help the entrepreneurs regarding funding, links with the banks, etc., etc. Second action is the collective coaching. So we have a specific EU project that help us to have a new, since 7 years now, to provide collective coaching on specific topic for medtech entrepreneurs. And so it's a 5 months program. It's just we have a session today, so I will go to the session just after, and the idea is to have the final session in September. So the MedTech Atelier, this is more the idea is to provide support on prototyping aspects. So we work with many experts, and the idea is to give access to expertise, but also to equipment that is available in the Brussels region, to help the entrepreneurs to have access to prototyping facilities. Then, and this is one of the main action of the cluster, of course, is to break the silos and to make the link between the different actors by organizing many events. It could be networking events, but also workshops, pitching sessions also it could be with users, it could be with investors. So the idea is really to put the solutions directly to the users or to the funders. Of course, we have an advisory board, and we have to work also with the government and different trade association that we have in Brussels and in Belgium. This is the way also we define the strategy and the next action of the cluster. Then we work on the visibility, of course. And then internationalization is really important for us, because we have a specific team dedicated to organize the fair, the congress, the trade missions, etc. But also we have a EU team to help the entrepreneurs to find the right European codes for projects, and also to find partners next to the NCP and the Enterprise Europe network. And then finally, this is the new project. So we have a project dedicated to prevention. So the idea is really to help the entrepreneurs to find a new business model, because we know that it's quite complicated to find a business model for prevention projects. So we have different action on the topic. The idea is really to build a new community, to work with new actors that we are not used to work with. And the second action, and this could be quite useful for you too, is to put and to develop innovation center directly inside hospitals. And this was a call for projects for Brussels hospitals. We have to analyze and to define tomorrow the hospitals that we will be the first one to implement this innovation center, and I will be pleased to present it in some months maybe, to explain a little bit how it works and what we will do. We have done, and we are making also a study, a benchmarking. And this is maybe useful also to tell that we are working with Stockholm and Berlin on the topic. So maybe we could certainly talk about it, and then we will try also to facilitate the links between innovations and users, organizing short breaks in the hospitals with the nurses, with the medical doctors, with the specialists, etc., to present innovation solution, but also specific topic that could be useful just to sensitize to the innovation that we have in the region. So I don't want to go further, but the idea is, of course, to talk a little bit later about the different topics if you are interested. This is just a snapshot of some of our projects, just explaining that we cover many topics about robotics, about mobile health, application, 3D printing, so many solutions that we have. So many origins also coming from nurses, coming from medical doctors, coming from economics background, so many different entrepreneurs. And so you can find a snapshot of all the members on the website. And do not hesitate, of course, to visit our two websites about the acceleration program and about the ecosystem. And I will be happy to discuss with you just later. Thank you.